Mission, vision, goals, and values are important for organizations because they provide guidance and direction for the business. These statements can help organizations achieve their goals, meet financial objectives, and ensure that patients have a positive experience. They can also help organizations save time and money and increase the likelihood of success. For our center, our mission is to advocate for the geriatric population so they can receive adequate health care. Our vision is to provide accessible health care for the geriatric population. Our goals are to provide accessible and affordable primary care and chronic disease management to the geriatric population in our community. And our vision is to be committed, compassionate, and trustworthy to our patients. We are proposing a comprehensive healthcare center for the elderly population. The center will focus on providing services including regular checkups, screenings, vaccinations, health education, nutrition, and mental health services. The practice is necessary because the elderly population may need special care and attention in turn, which can help them lead healthy and worry-free lives. Access to adequate health care throughout our lifetime. But as we age, our needs become more complex. As we age, the risk for chronic disease increases. The elderly are at risk for diabetes, dementia, and heart disease. Older adults face barriers to health care. Many live in areas where there's limited transportation to get to their appointments. Additionally, older adults struggle to understand the complex health information. Our center will be easily accessible by public transportation. Legal considerations are important when opening a health practice because they help protect patients and the practice from liability and harm. They also ensure that the practice is delivering safe, ethical, and high-quality care. Nurse practitioners can open their own practice in 27 states that offer full practice authority, including New York. But there are legal concerns that the NP must consider when wanting to open a practice. NPs must obtain the appropriate credentials and licensure for their state. Determined scope of practice is important because some states grant full practice authority, and understanding professional boundaries and authorities is important for a successful practice. In New York, NPs can practice independently if they have more than 3,600 hours of quality practice experience. Nurse practitioners would need to be credentialed with insurance companies in order to be reimbursed for their services. Depending on the state, an NP would need to obtain a collaborating physician, and written collaborative agreements address the following: patient referral and consultations, coverage for emergencies while the NP or the collaborating physician is away, written practice protocols that the NP must follow, peer review of the patient's trust by the collaborating physician in a timely manner, no less than 3-month intervals. A copy of the collaborative agreement must be displayed in the practice and made available by the New York State Department of Education. There are a variety of New York and federal laws that affect financial relationships between healthcare practitioners. There are some types of financial relationships that are prohibited by the educational law, such as kickbacks and fee splitting. NPs should be up to date on business laws and regulations. This is important to be able to understand what licenses and permits are required to open a medical practice. NPs should obtain liability insurance to cover medical malpractice errors and negligence. And NPs are required to work pursuant to protocols reflecting the specialty area in which the NP is certified.
Our geriatric community health center provides primary care services such as initial and follow-up visits, referrals for chronic disease management, disease prevention, screening, lab testing, vaccinations, telehealth follow-up, house maintenance, education to patient and caregiver, and also other supportive services as needed. Our expert consultation include business consultation, legal consultation, and content consultation. A business consultant who has experience in healthcare management is necessary for new business owners to get professional business advice in business structure, operation, and management. Our geriatric health clinic can choose to form an LLC initially. In addition, CPA accountant consultation is also crucial for business structure, tax consultation, payroll management, and profit loss statement and analysis for long-term management. Our geriatric health center startup fund will be mainly from a business loan. Business planning and secure funding are crucial for a new medical practice. We can also consider a combination of funding sources to meet the capital requirements while minimizing risks. So traditional funding sources include banks or credit unions. Healthcare medical practice startup loans can cover initial expenses and invest in the equipment, facility rental, and meet payroll that is needed to launch the new medical practice. Bank loans are usually quicker than other financing options such as grants. New York State small business loans for medical practice can also be an option. The Small Business Administration loan is one of the most popular products and offers small business owners great terms and a longer repayment period. The loan can be used for business purposes such as purchasing equipment, refinancing debts, buying or expanding the business, or financing commercial real estate and working capital. State and local governments also offer grants to support healthcare services. Grants from the Department of Health or New York Health Foundation. For example, New York Health Foundation has grant project to enhance primary care in New York State to expand primary care access, capability, and advancing racial health equity. However, government funding grants are very competitive and time-consuming for applications. So we can consider searching and apply for any applicable grants that aim to improve geriatric primary care in the future. This slide is about our initial startup cost. Our startup fund will be from a business loan of $500,000. The initial startup cost is include professional consultation fees, first month's rental, lease security, broker leasing commissions, office equipment and supplies, EMR system, and marketing, malpractice insurance, and other professional fees. So it calculated is about $81,000 for the initial startup costs. This slide is about our monthly expenses, which include the rentals, monthly rentals, and some management fees such as utilities, taxes, insurance, maintenance, and also we S&P, we also want to work with a collaborating physician for the chart review, marketing, monthly marketing fee, business loan and fees monthly, accountant, billing service, office supplies. So it's about $17,000 per month. So the most costly part is about the payroll. So we calculate at 2 full-time nurse practitioner, one full-time medical assistant, one full-time receptionist, and one full-time office manager. And also we added benefits and taxes. So the total monthly experience is about $68,000 per month. This chart is about our fee structure. Our revenue will from the major medical insurance plan reimbursement for office visit, new patient or follow-up patient. We also have a self-pay price for different services. Our profit and loss is calculated by projected first year office visit volume based on 2 full-time NPs, 1 full-time MA, 1 full-time reception, and 1 full-time office manager. So it is projected that office visit volume will be very low initially, but with the marketing and patients follow-up, it will be increased every month. So the revenue is calculated by major services at the lowest quarter visit value with lowest insurance reimbursement rate. So our projected total first year expenses is 900,000. Our projected total first year revenue is 1,301,500, and the project first year profit is about 400,000. This is the calculation of our first quarter revenue. So it projected the first quarter, we only have 10 visits per day per NP. So different services we calculate based on the CPT code for initial visit, follow-up visit, and self-pay. So this is the first quarter calculation. This is the second quarter calculation. We changed the visit volume from 10 visits per day to 15 visits per day per NP. So this is the total projected initial visit volume for the 3 months. So this is the calculation. For the third quarter, we project our business will continue growth. So we project our third quarter at 20 visits per day per NP. Our last quarter for the first year, we expect we can do 20 visits per day per NP. So this is our goal. The calculation is based on the volume of different services during the 3 months. Calculated by different CPT code with the insurance reimbursement rate. This slide is our overall annual budget, our projected first year expenses, revenue, and our first year profit will be $400,000 for the first year. Thank you very much for reviewing our business plan presentation. Thank you.